Hey everyone, welcome back to our series on the Health Can't Wait Act of 2019 regarding the prior authorization process and how it impacts patient care. We are discussing the proposed legislation of this act, and today I want to talk about the aspect of legislation that deals with clinical validity. So, what this part of the legislation is talking about concerns the validity, the accuracy of the denials in the authorization process. Some of the concern comes about when the process of authorization is coordinated and determined, and potentially that authorization is denied by a physician or someone reviewing the chart who doesn't typically interact with patients in that same specialty. So, the first requirement of this legislation is that insurers base their authorization on peer reviewed clinical criteria. This means that they must have input on the criteria from physicians practicing in that specific area of medicine. One example in my experience has been denials for a request to have an MRI done by a radiologist who has never sat in front of a patient with chronic pain or determined the need to order an X-ray versus a CT scan or an MRI, but instead is simply denying the request that I've made based on an algorithm and a stepwise treatment process that's been predetermined by the insurer, not taking into account my specific specialty area of expertise and the issues that are being presented by the patient in front of me. So, the first aspect of this legislation states that insurers must base their process and their authorization criteria on peer reviewed clinical criteria. Next, this legislation requires that denied requests be reviewed by licensed physicians in the same specialty as the provider, who typically also manage that same condition. So, again, getting back to what I said before, the physician who is evaluating the authorization request for the treatment I proposed, it makes sense that they should have the same training that I've had, that they've evaluated patients in a similar manner. And they may not agree on the exact specifics of the treatment, but overall, allowing me to do one type of procedure versus another, or doing something before physical therapy, that decision should come from someone who specializes in and has managed chronic pain, in my instance, for example. Another requirement is that the appeal for a denial must be reviewed by a licensed physician, again, actively practicing in that same field, but not employed by the insurance company. This allows a certain degree of impartiality to be prescribed on the situation, meaning that if this physician isn't employed by the insurance company, there isn't necessarily that same conflict of interest when he's reviewing a denial from a treatment plan that I proposed. And this allows us to get away from those conflicts and really look at the clinical criteria and make sure that best practices are being prescribed in my treatment plan for that specific condition. Finally, one other requirement includes that the medical directors of insurance companies who oversee the entirety of the insurance company care that's being authorized must be licensed to practice in the state of Michigan. This means that they need to have their ear to the ground, so to speak. They need to be in touch with trends in medicine in the state, and they need to have a license that allows them to practice so that they can be aware of some of the concerns overall that may be happening here in Michigan versus other states when they're determining the authorizations or the denials from that insurance company on a patient's care. So, to summarize, the clinical validity part of this proposed legislation ensures that we have physicians reviewing proposals for treatment who actually practice in that field, in that specialty. And if there is a denial, we have some impartiality, somebody outside the insurance company evaluating this to make sure that we're really only looking at the proposed treatment plan within that specialty area of medicine. I hope this helps clear up some of the concerns that we have about clinical validity and the ways that denials are being handed out. And I hope to see you guys continuing to engage with this initiative at healthcan'twait.org. And thanks for listening.